Good afternoon, ladies and gentlemen. Dr. João Aprígio continue today's work, okay, of the second day of the International Forum. The main topic of the session is, okay, human milk bank as health policy, human milk bank as a health public policy, as a public health policy, and support to breastfeeding. And also, I would like to invite to participate of this activity and to turn on their cameras, Ms. Alejandra Buiravich from the Human Milk Bank of Hospital Cutral in Argentina, in Plaza Huiquiu, and Ms. Fabiola Lopez Olivam from the Secretariat of Health of Mexico, Dr. João Aprígio. Okay, he is the coordinator of the Human Milk Bank Network from the Fiocruz Foundation, from the Osvaldo Cruz Foundation. I would like to pass the floor to Ms. Alejandra. Good morning to all. I am very thankful for being able to participate of this International Technical Cooperation Forum. I'm going to share my slides with you just a minute. And so during this International Technical Cooperation Forum on human milk banks, we are going to share with you the experiences that we have learned. What lessons did we learn, okay, during the COVID-19 pandemic, and what else can we do, okay? So humbly, I'm going to present how the network of human milk banks and what we did in the province of New Cane. And so we have about 500,000 inhabitants, okay? And we have a birth rate of 10,000 babies, and the prematurity is under 2.5 kilograms. So my name is Maria Alejandra Bueravich. I am a pediatrician. I work with lactancia, and I work at an institution that is called Healthcare for All. And so breastfeeding and human milk is a universal right, and every baby should be best breastfed or receive human milk. And so all of the mothers, they should count on this support. In this conceptual model, breastfeeding and so we had to overcome ourselves and many problems during the COVID-19 pandemic. And so we have been working with many structures, okay, many people, many healthcare professionals, so that we could have social mobilization, and so that we could receive the right budgeting, so that we could have the right public policies implemented, the right legislation, so that we could carry out the health surveillance necessary during the pandemic. This human milk bank network that works in this province in Argentina, and the HMBs, they were essential, okay, for everybody, okay, in all of the levels of our society. And so we have friendly places for moms to breastfeed, and they can breastfeed their babies in public places. And during the pandemic, this was not made possible. And so at the collection points is where we collected the milk for the babies, okay? And these spaces, they are community milk collection centers, and they work in several neighborhoods of our community, and we have highly qualified people to help the moms carry out their donations. Okay, so the Human Milk Bank Network, in New King has something very simple. And we can use, and the moms can use their cell phones, and then they can have access to all of we can have access to all of the donating moms. And by using this technology and cell phones, we can register the donating moms, we can help them. So if their condition, their healthcare condition is green, they can donate. If the color is yellow, they are just starting, okay? They are still pending. And in red is when they suspend their donations or they simply quit donating. And then we exclude that name from the list. And during the pandemic, we have the blue color, the light blue color, and because they were tested positive for COVID-19. And you can see on these photos, okay, we have a kindergarten, okay, and then we have the mothers there. And this place has become a center for the collection of human milk, okay? And so they can breastfeed their babies here, and they can also donate human milk. And so we have continued on this path of promoting accessibility and to continue our activities. And then on their cell phone, we can have the names of the mothers, we can find out where they live, we can have their telephone number, what is their status, if they are green, yellow, red, or light blue. And in red, they're not donating anymore. And in blue, we have a positive case of COVID-19. And we are not going to abandon this mom. We're going to offer help to this mom, and we're going to tell her what she can do during the time that she is contaminated by the novel coronavirus. So the Human Milk Network, we never stop. It can be snowing, it can be raining, it can be windy. We never stop. And we have taken all of the necessary protection measures, and then we go from home to home. This was our great strategy. We never stopped. We never stopped. And so we were trying to help all the families, all of the donating moms, all the time. We never stopped. And so when the milk arrives at the different hospitals and clinics, we give this milk to public and private hospitals as well, to public and private institutions. And so when the milk arrives, it's going to be monitored, okay? And then it's going to be processed, and then it's going to be handed to a neonatal ICU. And all of the hospitals, they have the system, okay? And they have the information, who was the mother that donated. And so they know who that milk is meant for, okay? And this was created in our provinces. And we have a list of all of the institutions that are part of the Human Milk Donation Network. Okay, and we have a lot of hope, okay? The pandemic has brought with it many changes, but your donation is bringing to everybody a lot of hope. We know that the HMBs have a multidisciplinary team, a multidisciplinary staff, doctors, nutritionists, nurses, okay? And all of us, we join the work, we help the work, okay? And we try to promote the importance of breastfeeding, of donating human milk. And so we have almost 40 hubs, okay? 40 hubs. and we are always trying to find innovative technologies and changes to assist our work and to improve our work. So if you donate milk, you are donating life, okay? And so this mother is donating milk to us, as you can see in the photo, okay? And so this human milk network of NewCan, and so in the milk bank, we are continuing to have the breastfeeding centers. And so we have also the community milk collection centers, okay? And this network encompasses all of the institutes and centers that are necessary to form this human milk network. So this is a mom who is donating milk, and she is 400 kilometers away from our milk bank. And she is donating the milk with all of her love to the nurse that is collecting the milk. And so this way to manage the human milk banks, and moms are donating human milk for over 5 years now. We have collected over 5,000 liters. And so there are many people that are part of this network, and we have helped over 1,300 newborn babies. And so in Argentina, we have 8 HMBs, and the first HMB was started on the 14th of May. On the 14th of May, 14 years ago, the first one was in the province of La Plata, and the second was in Buenos Aires, and the third was in Chaco, the fourth in Cordoba in the hospital Ramon Carrillo, in the fifth in Mendoza, in the sixth our bank in Neuquén, and the seventh in Rio Negro in the Lima hospital, and the eighth one and the last one to be born was in the province of Corrientes, was the University Hospital. All of them celebrating the HMBs and the donation of human milk. And so they are trying to offer complete health to our babies, okay? And so now the University of Flores is also opening up a breastfeeding center and a human milk collection center. Okay. And so the university students, they want to participate, okay, during the pandemic, okay? And they have the essential job of creating this, showing, okay, all they can do to say goodbye to all. So and this is the first mom of this new HMB. And these are her babies. Okay, so they were triplets. They were underweight when they were born. They were born premature, and now they are 5 years old. Okay, and as you can see, there was this biological privilege. Okay, biological privilege. And so, with a lot of solidarity, innovation, dedication, and communication, and we want to have a better world. Thank you so much for your attention.
This is Fabiola Lopez from Gender and Reproduction from the Secretariat of Mexico. All of the team that is behind this for the invitation, Technical Cooperation Forum, and to be able to share the experiences that we've had in our country. As our companions have commented, we've also put this in Mexico, and I would like to comment that February of 2020, we had the first positive case, and this pandemic and this year brought a lot of changes, and with them also a great work. So at the end of the day, those 2 million newborns in this country have any hope. This is some of the numbers that are available in our web pages. And what is truth? The 2 million people who were infected, but there are a series of communication at the national level, and also comes the need to share experiences due to the coronavirus and how would be the management in breastfeeding centers. And there are some women go that are pregnant, and unfortunately also some of the health personnel also were sick. There are two federative entities, 19 of them. Some entities, like you can see here, that are very dispersed, like the northern border, and most of those milk banks are in the middle of the country. Some of the federative units have up to eight of these HMBs, and four of them have four HMBs, but the majority only has one HMB. And at this moment continues to grow. And since 2009, we started to work this part of cooperation on the information and implementation of Brazil of these HMBs. With the cooperation in Brazil, this has grown a lot. Now we have 32 HMBs, and many of these entities are enormous. And there are 13 that are in, oh, 3 are in implementation phase, and some entities that do not have a working HMB might get to it. The majority of the hospitals of the country are working in the sense of these 10 steps to having successful breastfeeding. And there are agreements, norms in Mexico, and we continue giving this support to mothers breastfeeding. At some moments, we had some complications in the beginning of the pandemic. The uncertainty, they didn't want to come to the hospitals. And also we had to change how we dealt with women in these areas and in the HMBs at hospitals. Many women at that moment wanted to be donors and started to reduce this and reinforcing our companions from where their trenches, their areas, information that they can breastfeed, and they continue donating, doing routine exams for the mothers, and giving this information, not only women, but women or those that are breastfeeding more than 6 months or up to 2 years. Also women who had these stories with this donation. We can see these numbers. It's a lot of work behind all of this. In those 32 HMBs, in order that the women at the end of the day are helping us, giving part of their valuable product, that is the milk. And the general measures that were carried out in terms of our national journey of social distancing. This had to be informed, all of hospitals, with our team for the protection of our personnel. Many hospitals were converted. Like yesterday, was mentioned yesterday, also happened in hospitals in Brazil, where you had hybrid hospitals, where you could give this specific type of attention to everyone. No doubt, in the presentation, there was a reduction in the health personnel due to some risk groups, and this complicated in how to deal with these mothers. Most of the personnel that were left in the HMBs had to have a effective means of communicating. There were some hospital filters, be it for health personnel or for the users. We had additional questionnaires trying to see if there was some kind of symptoms, respiratory symptoms, and some were temporarily suspended. Some images of our health personnel that was working in this hospital with this protection equipment, a lot of photos, many images. After using this equipment, but no doubt the health personnel in all hospitals were giving training, orientation, had all of the support so that these newborns had the best food. And we thank them all. Personal protection to each of these workers that were in these, I think this was very important. And you can see in intensive therapy, they were staying together in maternities, wards, and home visited. They had this equipment, protection equipment. I like to highlight once more biosecurity measures, be it for the health workers or for users. Most of the hospitals had specific norms to wash hands, but in all hospitals this happened, especially those that had HMBs. And at some moment, we would take temperatures, health personnel, and some users. And in some of the hospitals, we did kind of saturation especially for those women who had gone through the situation or had coronavirus or had a positive result. So the situation for the health personnel, many of the personnel had to be safeguarded. There were health personnel that were incorporated to the work and giving this kind of orientation, and they had to be trained in managing and our initiative that of our friendly hospital, they had to be trained in the management and in all of these HMBs. This information had to be done by virtual means. This is how we've been working since last year. And you can see from the platforms of some institutes, some hospitals, they didn't stop giving this information to the participant, to the health personnel that was recently joined or had recently joined. And they would present in the hospitals the increment of the positive cases or those that were suspected. And this could be done by video call and I think that the social networks were very important in order to give support to the women in this practice of breastfeeding. And in some hospitals, the way in we could train the women, there was symptomatics and also, and in the hospitals where these positive case or suspected cases, there were orientation. So the women didn't stop carrying out these practices. Some hospitals that following the norms also would allow this skin to skin for longer, of course, with all the measures of biosecurity. And there are many complications, of course, in the terms of feeding these kids. Also, there was a lot of information and support in, in combating some of the myths that were set about breastfeeding. And afterwards, the support we had with Brazil last year, reinforcing the process and the training, and in terms of information, in terms of people who had newborns, and the hospitals in some way also had to carry out their own documents in the inside to allow for training, information that was very assertive, to confirm that all mothers, they could be breastfeeding for their newborn, and emphasizing some interventions from the hospitals, techniques that would be good for the newborn, skin to skin. I think this is important. This is important to all our newborns. We also had an important aspect, 74% or percentage of our newborns that were premature. And in the social media, to inform the population how to deal with motherhood during the COVID crisis and to give support to them.
Algunos hospitales y bancos de leche.
In some hospitals and milk banks, we could observe that we're close to have an increase in production of milk. Also helped. There was a call to donation, and there was a response by the women, and some of the HMBs would do specific routes in order to support of the women that had the milk, and that could send them to the HMBs for all the women to carry out this kind of donation. In Mexico, these collection points, we call them lactaries, and there was also a biosecurity protocols for personnel and the users. There was a reduction in the number of users, and they had to be scheduled so that they could be used. And we stopped all the group dynamics, and was emphasized that those had recently come in and as potential donators. Into the situation and less users, and could allow for training. Some of these collection centers started to use the state networks, which was the case of one of the states, of what we call these lactaries, these collection points. And the social networks, there was help with all of the themes of breastfeeding for women that had any problem, and especially in terms of orienting also the family about suspected or positive cases, that they should do this and give orientation of the conservation and transport. These are the spaces we called lactaries or collection centers. We had to do so by writing, live, virtual. These were spaces where we could collect the milk, and all our colleagues made a wonderful work so that we could have this milk. In the hospitals, some of them did a reception or a view of the glasses in the main entrance due to the risk of users. Some of them we did a quick test and a clinical history as well of some of these. That's how we managed some of the HMBs,
de seguridad se
and
brindó
all
para
of the teams, the protection was sent to these HMBs. A lot of work, institutional work. In some moments, some federative units, we also needed some material, especially of vials, glasses, and people responded in terms of donating these glasses vials and of the what we called mobile lactaries or collection points would take these vials to the HMBs, and the banks also would give this information in terms of biosecurity for the management of the milk. Some of the families that were healthy could also support the women with transport of the milk. And the house visits that we used to do, that also was reduced because there was a route to be able to carry out this collection of milk. And in some of the banks, we had at that moment new donors to have these questionnaires and to have a clinical history. The collection in some of the cases were through from the door of the houses when they, but they did invite the health workers into their houses. But we had to modify this due to the situation. Like I mentioned, more than 2 million newborns in 2020. These kids were benefited with this milk that was processed in the HMBs, because in some hospitals there were authorizations in how is the feeding of these babies and how you could find and how they could collect the milk and how to give. Most of hospitals that have these banks have this kind of signaling so that they can see how is the feeding of the baby and how they should improve. And in some places, there are some health personnel that are behind them to support the baby, to help them in some sense, so that they don't lose any milk. Some patients also, so we had a better feeding of these babies. Some of the images of some of the small ones that were benefited from this milk, and we know that some, in some occasions, they are months in the hospitals.
para todos estos chiquitos tener estas
So it's a relief for all of us of having this success stories of these babies and having human milk. We said this very quickly, but it was a great year for all of us. But I would like to thank all of the teams of the Mexican network of HMBs, giving the best food to these newborns despite COVID, and they giving this kind of information. And I comment with some numbers to help the users and to be able to carry out Some HMBs had to be closed because there weren't enough personnel at that moment. And in the Tijuana hospital, for example, that was dealing with the northern border, so there were personnel that resigned or went to other areas. But well, the intention was that the HMBs, someone had to be there to process and to hand over, and most of them were able to manage. So I would like to thank all of the teams that are behind of this Mexican network of HMBs, and with all the efforts they carried out and continue to carry out in order to have this number of kids benefited. Thank you very much. Thank you, Fabiola, for your contribution, for your presentation. I would like to call Dr. João from the Fiocruz. You have the floor.
Obrigado, Jonas. Muchas gracias, Fabiola. Muchas gracias, Alejandra.
Muito obrigado, Fabiola. Obrigada, Alejandra. É um prazer tê-las. Also, it's a pleasure to have you, and it's good to have this experience of facing COVID in this year. It was a very hard year. It is a pleasure. It's a pleasure to be with all of you here. And in this theme, falls upon me.
Lo tenemos, não? E tá chegando bem a tradução do espanhol para todos, sem problema?
Can you hear well the translation? Can I continue in Portuguese? Okay. Okay, I'll continue in Portuguese then. Otherwise, do warn me, and I'll just change, and I'll go to Portugal. Well, so the theme that falls upon me to put forth here today is in this process, not only of construction of our global network, but specifically facing COVID, this serious health issue, the importance of multilateral coordination. So these spaces for multilateral articulation are extremely important, and we've, over history, had the opportunity of great success in building within these spaces of the General Secretary Ibero-American, the Community for Brazilian Language Speakers, BRICS, Mercosul. We had the opportunity of working the construction of networks at the macro level. And I would like to bring what is the real importance that we give to these spaces, how decisive they are for the results of our work and the work that all of us do in our networks within our countries. I would like to say to all of you, I'm doing on purpose a device this is known very much by all of us. That's our logo on the left of the Brazilian network of HMBs, which was substituted by the global network. But this logo is symbolic.
Ela sofreu uma adaptação.
It suffered an adaptation when in 2015, we had 30 years of human milk banks policies. Think about that fact. It's extremely important. We have nowadays in Brazil 36 years of public policies related to these HMBs. For 36 years, our actions in these human milk banks is worked as something, a state policy by the Brazilian government, and this has been decisive for all of us, be it in the process of expansion and consolidation of our actions in all of the national territory. And it is unnecessary to say how big the country is, the complexity of the country. It's unnecessary to say the amount of units and services and the level of difficulty that is imposed upon us.
Do ponto de vista das relações
So in
internas,
reality, from the point of view of internal relations, to work with this plurality and these peculiarities, geopolitic, that are inserted in all the national territory, has given us a very big experience in those 15 first years in building that Brazilian network. That was the need of developing strategies that would allow us to work in a horizontal manner, in a participative manner. And we're talking here about a work that started in the 80s,
se discute e o que
very much before of the important elements that give sustenance to the South-South or horizontal cooperation. So this action was decisive to the process of internationalization. So that's the first point I would like to highlight, of the importance of us working in a space, in multi-spaces, for multilateral agreements. I'm talking about Brazil in articulating this multilateral aspect, but within the national territory, where we have our federative units with our managements at the state and municipal level as well. When we think about planning, when we are in the location as managers of these public policies in our respective countries,
tão conhecida por todos, né?
This logo that is so easily recognized. So when we think about planning, what is important to bring to the center of our action? No doubt, the history, or our history, had shown or demonstrated, and more than that, has allowed to prove that the central element is that which is symbolized in this image, which is sustainability. No doubt that the technical dimensions are extremely important. To work with human milk so that we can answer in a more prompt way of the need of each newborn, low weight, premature, secondary pathologies, or problems with the digestive tubes, newborns with whatever specificity they might have. But if our focus is exclusively in that dimension, which is our reason to be, which is clinical dimension of the clinical response of our work, it'll be very hard, telling the truth. We will have the chance to conduct our actions in an effective manner. Why do I say this with such vehemence here in Brazil, and of having the opportunity of sharing good practices, ideas, experiments with Alejandra in Argentina, with all colleagues in Argentina, Fabiola and our companions from Mexico and other countries that certainly are with us effectively, because the moment we think about planning, our central concern is in terms of forecasting the demands that will come from what we know in practice. We need fundamentally to concentrate in the hard art of predictability, If I wait to happen something as was recently happened with the pandemic, this COVID pandemic, we went through a real pandemonium because we didn't have the opportunity of the predictability. I think this is the best of the examples that we can bring in this moment to forecast demands starts with this important dimension, this technical dimension. I need inputs, I need personnel, I need, and I continue to need. But to make viable all of these issues coming from the practice, I need something extremely important, which is the availability of financial resources. If I don't have resources, if I don't have my budget, if I don't have my budgeting defined, I cannot have my technical actions made viable. So these two elements only will be possible, the technical and the financial, if we do equated to the dimension, which is the political dimension that confers our action and the policies, and I mean the public policy, because it's that dimension that will give the due importance of our action in the context of local health, territorial. Having said that, if we say we have to have questions related to sustainability, quality, management, I have to have human resources in sufficient quality and quantity to make our actions possible. I need projects, installations, technical regulation that will give us security that our clients need, be our greater clients, which are the premature babies that receive our product, be it their families, the mothers that are being aided in our HMBs with actions to protect breastfeeding or support breastfeeding. So I need to plan, execute, considering all of these elements. But nothing of that is possible without seeking a path where I have a political sustainability. So this sustainability has to be duly contemplated in a reference mark for the country, for the region, for the globe. If we look at our health agendas in a very appropriate and pertinent way, are put in what is contemplated in the SDGs, Sustainable Development Goals. Until 2015, when we talked about the 2030 agenda, our agendas, our actions were at the global health with those Millennium Goals. And now that we have this macro reference and we rolled out this macro reference, we built in each of our nations, in each of our countries, in each of our states, the references necessary that will be observed in the constructions of objectives, goals, in constructing a policy, health policy for the nation.
That is, there is a document that gathers and encompasses all of this and translates a set of laws, regulations, guidelines, and devices, regulation devices, so that the entire healthcare systems, they can work, be them a unique one, a unified one or no. And within this framework, this legal framework, we should insert our actions regarding the HMBs that are so important as the dimension, the clinical dimension, the technical dimension, the financial dimension. And so we should start working on this greater referential within this larger legal framework in a healthcare sector of a country and insert the HMBs. Sustainability, therefore, depends on three clearly defined dimensions. And we could spend the whole afternoon discussing this, the dimensions that are political, financial, and technical. Okay, given the importance of all of this within a country, I would like to discuss a little bit about this movement. How can we look at this situation within a political framework that is broader and also the international relations framework? And so relationships not only between the Oswaldo Cruz Foundation, Fiocruz, but in the hospitals, or Neuquén Hospital or La Plata Hospital, any hospital in Mexico. We truly work along a process with a process, and we are trying to learn how to work like this with the participation of the Brazilian state, the Brazilian public sector. That's why the ABC is so important, because it added the topic of HMBs and it transformed it into a state policy. And they started sharing these best practices that were already important, supported, disseminated by PAHO throughout the entire Americas and the Caribbean. And so our process and our project is also part of the political framework of our international relations. And so this framework is leaving the local level, the national level, pardon me, from the local level, and it's reaching a national level, and now it's gaining the state as a whole at a regional level. So I would just like to remind you, most of us who are here now, you are builders of this history. And so the first movement that we had was in the construction of the first referential framework, which was Brasilia's letter in 2005. And also the first meeting of HMBs that we had was in 2005, and the letter of Brasilia #1, involving 11 countries. We discussed in a very effective way how we could, based on each country's abilities, to sign a commitment to share the best practices, to support one another, to help one another. And so we had Argentina, Bolivia, Brazil, Colombia, Costa Rica, Cuba, Ecuador, Guatemala, Paraguay, Uruguay, and Venezuela. And we would receive support from UNICEF, from WABA, from IBFAN, from APAHO, so that we could make the HMBs possible within Latin America. And this movement was the foundation. It was the initial, or the first kick, the initial kick. And so please pay attention to how important this multilateral cooperation and negotiations are. So at the same table, we started discussing with our dear Rubens Paniza, that you can see on the photo there. And we started discussing what would be the common points between Uruguay, Brazil, Miguel Soto in Guatemala, and the other dear friends, Paulo Lope from Cuba, Dilma from Guatemala. what could we do? Did we have as a common point? And so we created the first forum, the true forum. And then we started creating a real network in Latin America. And so ABC, the bilateral cooperation agreements with the participation of the Brazilian state and the other countries. I'm not going to list all of them because I may commit a mistake and forget one of the countries. And so these events, they became very, very important. And the Brazilian Cooperation Agency, the ABC, said that this topic should be discussed during a multilateral forum in 2007. And so the proposal that this action of HMBs should be discussed in this place of exchanges, of multilateral coordination, that this should happen within the General Secretariat, the General Ibero-American Secretariat, yes? So that we could discuss the HMB network. And then we had the executive secretariat being created. After that moment, we started to discuss our actions jointly, all of our needs, all of our joint needs, of course, respecting the specificities and particularities of each country, of course. But the major discussion would be, what do we have in common with Mexico, with Argentina, with Costa Rica, with El Salvador, with Guatemala, with Angola, with Colombia, with Ecuador, etc. This coordination was extremely rich and fruitful because we were able to share not only the technical dimension to ensure the quality of our processes, of our mechanisms, but also the perspective, the objective perspective of ensuring the quality at low costs and also reducing our operational costs. And to that end, in fact, we managed to move forward so that we could discuss, as we did with Fabiola. Fabiola is here, with Mexico, and we discussed with us and with other countries such as Colombia that should be with us now to work on a public policy, a public health care policy, a state policy regarding HMBs. So based on this perspective, in 2015, we changed our referentials, our perspectives. And so in 2005, we had the Latin American Network. In 2010, Angola joined us. And then we had the Afro-Ibero-American Network. And then we had Portugal. And then in 2015, we had a spectacular forum of multilateral coordination, okay, of human rights, and also of human milk bank networks. And then we had historical stakeholders here. Gustavo from Argentina, he has been following up the work that we do since the very beginning, and all the other colleagues. And so that network, from based on this letter by what was signed between the countries, this network started being called the Global HMB Network. And so it was guided by the SDGs created by the UN. And these guidelines made us get together and become stronger and stronger and closer and add more and more efforts towards this end. And so, and this is not the main issue now. So our referential, our political milestone within this healthcare policy are the SDGs. And in fact, we started with 2, 3, 17, but our main focus is on SDG number 3, okay? And number 7 or 17, I'm sorry, I couldn't hear him. And so within this coordination, okay, this more global coordination, there were specificities that were presented to us by our friends from Cape Verde. They have been our friends for a long time. And so we took this discussion to another forum with the support from ABC, which was the discussion of HMBs at the CPLP, which is the Community of Portuguese-Speaking Countries. So in 2017, we officially created, this is a photo where you can see all of the state ministers of health of the CLPL countries, okay? And they were creating this network. And these countries, just like Brazil and Portugal and Angola and Cape Verde, we continue discussing this at a macro forum, okay, of the global HMB network. And we started discussing the specific issues in particular to these countries of this region and the countries that speak Portuguese. So in 2019, during the meeting of all health ministers of the Mercosur, we had this meeting and we had the ministers of health of that time. And for me, this was very important because, among other things, we discussed a common regulation for the working of HMBs. And this happened on the 1st of November of 2019. And more recently, and I'm very proud to announce this, between the 28th and the 30th of August of 2019, we had the first BRICS workshop, okay, regarding HMBs. Russia was here, India was here, China was here. And in fact, throughout this entire process with discussions with Brazil, they came to know us, they paid a visit to our facilities, they got to know our logic with alternative methodologies at low costs, and they found out the need that we could scale up our work at low cost and with safety and security. And this was extremely important. Why? Because the conclusion that this group reached, all of these who were here, they were here not as individuals, but as legal entities, representatives of their states. And so after that meeting, they formalized a document suggesting to the ministers of health of each one of their countries the creation of the BRICS HMB network. And so this document for the creation of the BRICS HMB network was forwarded to the ministries of health of each country. And in the meetings between the ministers of health of October of 2019, they approved it, the summit approved it, and they created the BRICS HMB network. And this suggestion was forwarded to the forum of heads of state, members of the BRICS, and so they formalized the creation. But unfortunately, this stopped us from moving forward as we wanted because we were kind of run over by the pandemic, yes? And so recently, we started being officially something that we were doing in practice, but we started being PAHO and WHO collaborating centers so that we could carry out HMB work focused on the SDGs number 2, 3, and 17. So dear friends, I apologize because I have gone over my time a lot and I summarized everything, but I wanted to show to you and share with you from our perspective what is the importance of these coordination spaces, multilateral coordination spaces. I apologize for having taken long.